Oasis Center for Reproductive Medicine is a chain of IVF clinics started in 2009. We are headquartered in Hyderabad and we currently have 9 clinics and we're one of the fastest growing chains in the country. We started this company 10 years ago and it's been a fascinating journey in terms of establishing ourselves as the market leaders in the region, specifically AP and Telangana. We have made forays into Tamil Nadu and then now we are looking to expand pan-India. We're one of the few centers who have raised institutional capital 2 years ago from India Life Sciences Fund, and that has helped us look at expansion into other geographies as well. IVF is still a very fragmented segment. Right now, there are a lot of doctor-run clinics and practices which do exist. There is now a need for consolidation and institutionalized practice across the board, with good regulations that are coming in from the government. When the whole consolidation happens and we have a more established process-driven institutions, investors will look at it with a bit more excitement. The industry is growing at a very, very good pace of 20% year on year. We clearly know now with the millennials and the growing people delaying their pregnancy, in terms of them having a child, all of these things do add up to a lot of people seeking treatment. In fact, about when we started, 1 in 9 couples had some problem with infertility. Now we are 1 in 4 couples get affected with some degree of fertility problems. And there is a dire need of clinics both in Tier 1 and Tier 2 towns to address this need. We see a lot of players getting organized, so there will be probably 3 or 4 emerging leaders who would actually consolidate across geographies, and they would be then expanding into Tier 2 towns and other places to increase their footprint from a fertility standpoint. But there needs to be, the biggest challenge that we have, although we have the demand, is on the supply side, where there are not enough clinicians and embryologists. So strong training programs are of the need of the hour, and standardized protocols and the right process and the professional setup will give the industry the right impetus to grow. We have been growing at a healthy rate of 60% year on year, and we are actively looking to develop greenfield projects with the funding that we have received, as well as looking at inorganic expansion in different geographies where there are strong regional players and who would like to partner with us to take the practice in a much larger scale to provide the better treatment for all the couples who are suffering with infertility. So inorganic expansion is going to be our key focus area in the next 2 years to come. It's good, it's great. I mean, it's number one, it creates the awareness that's much needed right now in terms of fertility treatments. We see that there's been a lot of progress in the way people have accepted, taking fertility treatment not as a real problem. It needs to be treated. People have gathered courage there, and initiatives like this will help them come out more and discuss the real problem that they have in terms of fertility. And I thank the team for it.